even with this big scar on his leg, we're hopeful that he'll have a long, happy life and hopefully even be rideable or be able to have a job.
This is Matthias. He's the lateral leg wound debridement that we're going to do today. We're going to try and do him out on grass instead of in our surgery suite. So that way he'll be padded because he's so massive. We just wanted him to have a really nice, cushy place for laying down for the surgery. We're getting his pre-meds pulled up, and then we're going to get him out there in the 10-acre, and then we'll give him the rest.
Once this big guy is down, we are going to drive the side-by-side with all of our materials into the pasture so that when something so big is falling down, it's not falling on any of our nice medical things.
This handsome boy is Matthias. He has a very, very large wound on the lateral aspect of his right front leg that needs surgical debridement. We have gone back and forth with trying to attempt it standing, but because the surface area is so large, it would be really difficult to block the area and have him not feel it. So we are gonna elect general anesthesia. Matthias just came in last week. He is in quarantine. This big grassy pasture is a safe place for him to be induced and recover from general anesthesia. So we're gonna do his surgery out here and have him recover out here. Our goal is just to freshen up the wound edges. He has a lot less proud flesh than some of the ones that we have, so hopefully it'll be pretty quick. I do think it will be pretty vascular, so we expect to have some bleeding. We're gonna clip and scrub that whole leg up, and then he'll recover with his leg both bandaged and then having a standing wrap on there. Our anesthetic protocol is a standard milligrams per kilogram, and because he is so giant, we had to use a 30 milliliter syringe for his induction drugs. So he's getting a lot of medications, but he's a big boy. He does also have an enlarged hock joint. And if time allows and we can do it safely, we are gonna take radiographs while he's down, but that's not our top priority today. Here we go, handsome boy. Hi, you're okay? Yeah, I know I don't have Creech right now, but we had Creech before. You're a good boy. Good boy. Good boy. All right, how about that placement? Couldn't be more perfect. Hang on, let me pull this leg forward so we don't have nerve issues afterwards. Okay. I am using a scalpel to debride the edges of this wound that have kind of healed down and halted the epithelialization process, which is a really hard word to say. Basically, this wound is trying to close itself. We have nice, healthy baby skin, but at some point this wound didn't get the care that it needed and that baby skin kind of healed down to the tissue. We also likely have a biofilm going on where we have bacteria present, so we're gonna really scrub and clean. But the main part of this surgery is freshening up the edges of this wound so we can restart that process of growing baby skin that's gonna hopefully cover over this. This would be a great case for like a skin graft. Unfortunately, we don't have the funding to do a skin graft here, and this should hopefully provide him with a positive case outcome. This guy is only between 6 and 8 years old, and he's got a great personality. He's very respectful. He doesn't seem to be too lame on this leg, although we haven't done full lameness assessment on him. Obviously, this wound has been really bothering him, and he's gonna have a giant scar here, but if he is comfortable enough, even with this big scar on his leg, we're hopeful that he'll have a long, happy life and hopefully even be rideable or be able to have a job. I'm taking the, oh, this is so much easier. I'm taking the scalpel blade and kind of bluntly scraping to remove biofilm. look at that. I just got a big hunk off.
And there's not bleeding.
And there's no bleeding. It's like calcified skin. So the next step after clipping is done is to get chlorhexidine and scrub and scrub and scrub and scrub everything. Do you feel the like calcified thickening?
Yeah.
Let's put more pink chlorhexidine. Here we go. All right, now we basically do our pretend surgical prep because before everything was contaminated.
Oh, wow. You're a big boy.
I'll scrub while you pour. Just watch out for the stuff in the bucket. Love it. Thank you. Perfect. Awesome. Okay. I'm going to scrub one more time, and then I think we're ready to start bandaging. Everybody doing okay?
Yep, he's still doing good too.
Fantastic.
Yay, stay asleep so we can take
Look how great this looks.
This looks amazing.
Yeah. All right, good boy. Dr. Gina, I'm going to blot the surface of the wound dry.
Okay.
I feel like you want to just manuka that
Yeah.
and rub it in.
I am rubbing Manuka honey onto the wound. It says sterile Manuka wound dressing from New Zealand helps maintain a moist wound environment conducive to healing. So it kind of makes all the bacteria that are in the area swell with and taking all this, and they bust.
Also edible.
It is edible.
I was thinking about doing them this direction. So I think we might need a fair number of them.
I will open them and hand them to you.
We are finished with our surgical debridement. Really happy with how everything went. We got to the level of healthy vascular tissue, and we've got Manuka honey, some sterile nonstick Telfa pads, some roll gauze to absorb any bleeding or discharge, and then we're gonna do vet wrap and then elasticon and then a standing bandage. And then we'll check this guy for sure tomorrow. He's gonna be on systemic antibiotics and anti-inflammatories. And hopefully he won't need more than just this one time of debridement for this wound to finalize its healing process. We just finished doing a surgical wound debridement of his right front leg. He had a very sizable wound that his body's tried really, really hard to heal. It went very well. He hardly lost any blood. We were able to accomplish all of our goals with that. He also has an enlarged right hock. So Dr. Gina and Caitlin got some diagnostic radiographs of that hock. We're gonna look at those images later to try to interpret them better, but we didn't see anything too catastrophic in there. He is gonna get a vaccine booster. We want to make sure he's up to date on tetanus, and then hopefully he will wake up and recover uneventfully.
For Matthias's case update, we did notice that he started having some severe neurologic clinical symptoms, And so our top differential was EPM, amongst some other things like rabies or one of the encephalitis transmitted by biting mosquitoes. So we sent off a paired serum and CSF tap, which is from your spinal column. We sent those into IDEXX to be evaluated, and they both came back as very, very high titers, indications of that he has clinical disease. So he did have EPM. But unfortunately, his EPM symptoms advanced so rapidly that he was unable to eat, and he was very neurologic in the hind, so he was crossing his legs, so he was very unsteady on his feet, and for a big guy like himself, any muscle wasting, weakness, paralysis, paresis, those kinds of things are really detrimental to him and his quality of life. So given the results that we got and how rapidly he declined physically with having EPM, we elected to give him the last act of kindness in order to preserve some dignity for him and to keep him from just diminishing and becoming so incredibly weak and unable to eat that we just elected to do that for him. It is treatable if you catch it early enough to prevent it from progressing. There are 3 things on the market, 3 FDA-approved treatments on the market. They are all pretty expensive. 2 of them are within the $1,500 to $2,000 a month range. So it is treatable for anyone that has it, but it just doesn't guarantee that they won't have severe neurological symptoms, but if you catch it early enough. But we didn't know his history coming in. Matthias was pretty severe, unfortunately. We weren't able to get to him soon enough.